Breathlessness, dyspnea, its causes, clinical manifestation, treatment and prognosis. Definition. Dyspnea is a subjective sensation of difficult or uncomfortable breathing. It can be acute or chronic and is associated with cardiac, pulmonary, metabolic, neuromuscular and psychological condition. So causes of dyspnea. First is a cardiac cause. Dyspnea of cardiac origin is often due to increased pulmonary venous return or pressure, reduced cardiac output or fluid overload, left ventricular dysfunction and heart failure. Congestive heart failure, that is CSF, CHF, left ventricular failure, LVF, dilated cardiomyopathy, restrictive cardiomyopathy, myocardial infarction, that is MI, aortic stenosis or aortic regurgitation, mitral stenosis or mitral regurgitation. So, mechanism. Increase left atrial and pulmonary venous pressure causes pulmonary edema, which causes dyspnea, orthopnea and paroxysmal nocturnal dyspnea, that's P and D. Second is a pericardial and valvular disease, pericardial effusion and cardiac tamponade, constructive pericarditis, endocarditis. Mechanism. Impaired ventricular filling, which results into reduced cardiac output, which causes dyspnea on exertion. Now the pulmonary causes. Pulmonary hypertension and right heart failure. Pulmonary hypertension, cor pulmonary, pulmonary embolism. Mechanism of this. Increased pulmonary vascular resistance, which causes right heart strain, which results into reduced oxygenation. Now pulmonary causes. Dyspnea of pulmonary origin resulted from airway obstruction, parenchymal disease or impaired gas exchange. First is airway obstruction, asthma, chronic obstructive pulmonary disease, that is COPD, foreign body aspiration, tracheal stenosis. Now the mechanism. Increased airway resistance, which result into inadequate ventilation. Now the pulmonary parenchymal diseases. First is a pneumonia, second is a tuberculosis, third is a interstitial lung disease, that is ILD, pulmonary edema. Now the mechanism: inflammation, fibrosis, or alveolar fluid accumulation, which result into impaired gas exchange. Now the pulmonary vascular disease. First is a pulmonary embolism, pulmonary hypertension. Second, mechanism: reduced pulmonary perfusion causes hypoxia, which results into dyspnea. Neuromuscular and chest wall disorder, Guillain-Barré syndrome, myasthenia gravis, kyphoscoliosis, obesity, hypoventilation syndrome, and the mechanism: weakness or mechanical restriction, which results into inadequate ventilation. Other causes: one is a hematological and metabolic causes, anemia, acidosis, metabolic or respiratory, sepsis. Now mechanism: reduce oxygen delivery to tissue, which result into compensatory hyperventilation. Psychological causes are anxiety and panic disorder, hyperventilation syndrome. Mechanism: increased respiratory rate, which results into air hunger sensation. Environmental and drug induced causes: high altitude sickness, carbon monoxide poisoning, opioid overdose, that is a respiratory depression. Mechanism: impaired oxygenation or respiratory drive suppression. Now, the clinical manifestation based on the onset: acute dyspnea. First is a pulmonary embolism. Second is a myocardial infarction, anaphylaxis, foreign body aspiration. Now let's talk of the chronic dyspnea: COPD, interstitial lung disease, ILD, heart failure. Now let's talk about the based on the severity: exertional dyspnea, congestive heart failure, COPD, orthopnea, congestive heart failure, diaphragmatic paralysis, paroxysmal nocturnal dyspnea, that is PND, left heart failure, platypnea, which is worsening on sitting up, hepatopulmonary syndrome. Now, associate symptoms are cardiac dyspnea, edema, palpitation, paroxysmal nocturnal dyspnea, fatigue, pulmonary dyspnea. It causes cough, wheezing, hemoptysis, chest pain. Metabolic dyspnea. It causes fatigue, confusion, metabolic acidosis, signs. Neuromuscular dyspnea causes weakness or respiratory fatigue. Now let's talk about the diagnosis of dyspnea. Clinical examination. General examination will get a cyanosis, clubbing, edema, accessory muscle use. Cardiac examination will see murmur, gallop rhythm, jugular venous distension, JVD. Pulmonary examination we will get crackles, that is a pulmonary edema or pneumonia, wheeze in asthma and COPD. Now the diagnostic investigation. X-ray chest in which pulmonary edema, pneumonia, cardiomegaly. In ECG, myocardial infarction, arrhythmia, right heart strain. Echocardiography. In echocardiography, you will get reduced ejection fraction, valvular disease, pericardial effusion, pulmonary function test, that is a PFT. It will give COPD, asthma, ILD, ABG, arterial blood gas investigation, hypoxemia, hypercapnia, acidosis. D-dimer and CT pulmonary angiography for pulmonary embolism. CBC and hemoglobin for anemia. Treatment of dyspnea. First is the general measures. Oxygen therapy for hypoxemia. Positioning. Sitting upright. Reduce venous return. Non-invasive ventilation, that is NIV, CPAP or BiPAP in congestive heart failure, COPD. Specific treatment. If it is a cardiac dyspnea, diuretic like furosemide. For pulmonary congestion, AC inhibitor ramipril, which improves left ventricular function. Beta blocker, that is a carvedilol or metoprolol, which reduce cardiac workload. Nitrate, relieves pulmonary congestion in acute heart failure. Now the pulmonary dyspnea. Bronchodilator, salbutamol, ipratropium. For COPD, asthma, steroids like budesonide, prednisolone. For inflammatory lung disease, antibiotics like azithromycin, ceftriaxone. For pneumonia, tuberculosis, thrombolysis. For pulmonary edema, anemia related diseases, iron supplementation, that is a ferrous sulfate, blood transfusion if hemoglobin is less than 7. Neuromuscular and anxiety related dyspnea. Anxiolytic like benzodiazepine or panic-induced dyspnea. Now, physiotherapy and non-invasive ventilation for neuromuscular disorders. Prognosis. Acute dyspnea, that is a pulmonary embolism, myocardial infarction, anaphylaxis, high mortality without rapid intubation. Chronic dyspnea like COPD, interstitial lung disease, congestive heart failure, progressive but manageable. Reversible causes: anemia, anxiety, infection, and asthma. Good prognosis with treatment. So, in conclusion, dyspnea is a complex symptom requiring a multidisciplinary approach for accurate diagnosis and treatment, addressing underlying cardiac, pulmonary, and systemic condition, improve outcome, and enhance the patient's quality of life. Thank you.